Now after that we have a fascia that is known as the clavipectoral fascia. So where is you see the clavipectoral fascia? The clavipectoral fascia is seen extending from the upper border of this pectoralis minor muscle onto the undersurface of the clavicle. So somewhere here you see the pectoral fascia. So if you talk about the vertical extent of the clavipectoral fascia, you can see that this fascia arises from the undersurface of the clavicle. It is attached to a groove on the undersurface of clavicle, which is called the subclavian groove, and then it passes downwards. At the upper end of the pectoralis minor, this fascia splits and encloses the pectoralis minor. After enclosing the pectoralis minor, again at the lower border of the muscle, this fascia again splits and forms some ligament that is known as the suspensory ligament of axilla. So it forms the suspensory ligament of axilla. So you have the fascia, this is the vertical extent. So it extends from the upper border of pectoralis minor to the undersurface of the clavicle, and at the lower border of the pectoralis minor, after enclosing the pectoralis minor, this fascia again forms the suspensory ligament of axilla, which then continues with the axillary fascia somewhere here. So this suspensory ligament is then attached to the axillary fascia. And the horizontal extent, if you see, of the clavipectoral fascia, you can see that it is extending up to the intercostal spaces, the first two intercostal spaces. It extends in the region of the anterior intercostal membrane of the first two spaces, and laterally it is extending up to the region of the coracoid process. So it extends from the first two intercostal spaces, horizontal extension from the first two intercostal spaces to the coracoid process. So what are the structures which pierce the clavipectoral fascia? Many structures are piercing the clavipectoral fascia. One is the lateral pectoral nerve that you see. The other is the cephalic vein. And then you have the artery, that is the thoracoacromial artery, which forms four branches, and these four branches are the acromial branch, clavicular branch, deltoid branch, and the pectoral branch. So all these branches are also piercing the clavipectoral fascia together with the lateral pectoral nerve and the cephalic vein, plus few lymphatics also. So this was about the clavipectoral fascia.